When you arrive in the cath lab, you will be taken to a holding area where you will be placed on a stretcher. You will stay in the holding area until you go into the room to have the test. There is a nurse in the holding area that will be checking on you. The wait is usually short, but it may be longer if an emergency occurs or if an earlier dye test takes longer than expected. When the room where you will have your test is ready, you will be wheeled into the room and assisted onto a table similar to an X-ray table. You will be lying flat during the test. There is a camera over the table that allows the doctor to look at different parts of your heart. The camera comes close to your body, but it will not make contact with you. There will be nurses, X-ray techs, and doctors in the room. The staff in the room will be dressed in operating room clothes. The doctor will wear a mask and protective eyewear. Once you are on the table, your groins, arm, or wrist will be cleaned with a cold cleaning solution to prevent infection. You will then be covered from your neck down in large drapes. The drapes provide a sterile surface that the doctor can use for his instruments. The doctor will begin the procedure by freezing your groin, arm, or wrist. The freezing is the same type that is used by a dentist. If you've had reactions or allergies to freezing, tell the staff. Please tell the doctor if you are having any pain in the area so more freezing can be given. You will experience a pressure sensation as the tubes are inserted, but you should not have pain. Once the area to be used is frozen, the doctor will insert a small tube called a sheath. Once the sheath is in place, the doctor inserts a long wire through the sheath and inserts it until it reaches your heart. The doctor will then tell you to take a deep breath and hold it as he will inject dye into your heart. Most people experience a brief, warm sensation when the dye is injected. The dye allows the doctor to see how well the heart is pumping, narrowing or blockages in your arteries, and the heart valves. Be sure to tell someone if you are having any discomfort so it can be treated. The test takes about 30 to 60 minutes. After the test is completed, you will be assisted onto a stretcher and moved back to the holding area. In the holding area, a doctor or nurse will remove the sheath and hold heavy pressure on the site for 15 to 20 minutes to prevent the site from bleeding. Your blood pressure and pulse will be checked frequently. Once pressure is released, a dressing is placed over the site and you will be taken back to your room.